Okay, well, welcome everybody. I'm so happy to see a big crowd here for Courtney's presentation for Barrett Honors Thesis. I am Dr. Heather Ross, and I'm joined by my colleague, Dr. Laura Hosman, who is the co-founder and inventor of SolarSPELL, and to hear from Courtney Raymond and her Barrett Honors Thesis. So here's how we'll do this. Courtney, you will share with us your presentation, and we'll have some questions. We're going to run this, actually, this is going to be good practice for your future dissertation. I don't know if you knew that you were headed that way, but we'll nudge you that direction. But for your future dissertation defense, and before that, your master's thesis defense. So you'll present. We'll take some questions from the gathered group here, and then we will ask the gathered group to go, take your party somewhere else, because Dr. Hosman and I may have some questions for Courtney as well. And then we'll discuss while you're in a waiting room, Courtney, and then we'll bring you back. Okay?
Sounds like a plan to me.
Great. Dr. Hosman, anything to add?
Just really great to see this large crowd. This is quite amazing, and certainly the largest number of people I've seen at a thesis defense or presentation. So great to see you all. Courtney, looking forward to your presentation. Thanks, everyone.
Thank you, Dr. Hosman.
So Courtney, you should be able to share your screen if you have a PowerPoint to share. I will go on mute and you can take it away.
All right. Is everyone able to see my presentation at the moment?
Yes.
Well, I'd like to start by thanking everyone for attending this thesis presentation today. As you now know, I'm Courtney Raymond. I'm a 4+1 student, so currently completing my bachelor's and master's degree. This defense is for my bachelor's degree with Barrett Honors College. My topic is bringing evidence-based practice to developing and underprivileged countries with a specific focus on women's health and midwifery. My thesis director is Dr. Heather Ross, and my second chair is Dr. Laura Hosman. The goal of this thesis project in SolarSPELL Health was to provide health students and professionals in developing and underprivileged countries with resources for evidence-based practice learning and to help improve women's health in the country with the highest maternal mortality rate in the world. We're going to cover kind of a lot of information today in a relatively short time frame, so I'd like to lay out a quick agenda. First, we're going to go over an introduction to SolarSPELL, then to this project, how we went about creating the SolarSPELL Health Library, the challenges we faced along the way, implementation of the library, and then future directions for SolarSPELL Health and the women's health portion. So some of you here today already know what SolarSPELL is, either because you're a part of the organization or you've heard of me talk about it plenty over the last year or so. However, because some people in attendance do not, I'm going to start with a quick introduction. The title SolarSPELL stands for Solar Powered Educational Learning Library. The project was founded in 2015 by Dr. Laura Hosman and Mr. Bruce Bakey, who are co-directors currently. SolarSPELL units themselves are built to be ultra-portable and durable. We'll go over the contents on the following slide. The libraries themselves are host to open access educational content, and they contain a base library of materials, but they additionally contain regionally specific resources that tailor each library to the location they are deployed. The libraries themselves generate an offline Wi-Fi hotspot that doesn't require the internet or the use of mobile data to allow these people in resource-constrained locations to access the content and develop library search function skills. SolarSPELL utilizes a train-the-trainer implementation model to implement our units in the field. For SolarSPELL community libraries, we utilize our partnerships with the Peace Corps. We have a global strategic partnership that was actually completed this year, where we train individual SolarSPELL and Peace Corps volunteers in how to use the library and on the contents, who then use their community connections to implement the library into their locations. This image is of two SolarSPELL units, on the left showing the interior components and on the right the top solar panel. SolarSPELL units contain 5 main components, the first being a 10-watt solar panel made of plastic for extra durability. The second being a see-through waterproof plastic case that houses the following components. Number 3, a voltage regulator. You can see that here. Number 4, a battery which both stores power from the solar panel and powers the actual computer itself. And number 5, a micro SD card which stores the actual contents of the library itself and then also produces the Wi-Fi hotspot that devices are able to connect to. So why do we source open source content for our libraries? There's actually several reasons. The first being that it doesn't support publishers and paywalls. When you pay to access a journal article or a textbook, you're not actually supporting the scientists who did the research, but the publishers who own the content. So by doing open source content, it provides equitable access regardless of one's socioeconomic class or their social connections. Users are free to download and share our content without having to worry about violating intellectual property rights if they don't necessarily know all the rules. And it brings it back to science's core values of improving society and furthering society for altruistic reasons as opposed to making money. For an introduction to SolarSPELL Health, it was first proposed by Dr. Ross. Why we chose South Sudan is for several reasons. First, SolarSPELL, the overall SolarSPELL, already is partnered with several community and children's programs in South Sudan. Additionally, the health schools in South Sudan were willing to be engaged in the process all the way from brainstorming through implementation. And third, South Sudan is the newest country in the world. They gained independence from Sudan in just 2011, and they lack a lot of health infrastructure and resources that other countries may have access to. One of the main goals of SolarSPELL Health is to implement evidence-based practice training in a location where they've not had access to that before. And additionally, to update our Train the Trainer implementation, specifically no longer for Peace Corps volunteers, but instead for the instructors and students at these health schools so they can continue to use the model long after we've returned to the United States. The definition of evidence-based practice that I've used for my project is by you et al. Evidence-based practice is a problem-solving approach to clinical care that incorporates the conscious use of the best available scientific evidence, clinicians' expertise, and patients' values. One of the main goals of this project and key takeaways is ensuring that respectful blending of current practices in South Sudan while also encouraging the adoption of evidence-based practice methods. I want to go over some women's health knowledge in South Sudan that really puts a framework for this project. South Sudan has the highest maternal mortality rate in the world as of 2019. They have an average roughly 800 maternal deaths per 100,000 live births. For comparison, the United States has only 17.4 maternal deaths per 100,000 live births, and the world best is tied between 4 countries for only 2 maternal deaths per 100,000 live births. So you can see there's a long way to go with South Sudan in maternal health. A strained health system from lack of health infrastructure, economic crisis, and a current war in South Sudan leaves women, and especially pregnant women, particularly vulnerable to health inequities. 4 major areas of concern that were identified by one of our partners, GLOM, through their Safer Motherhood movement was obstetric fistula, sexually transmitted illnesses, emergency pregnancy complications, and menstrual health education. We'll jump into the methods section. The initial formation of the idea and the team. Dr. Ross, as I mentioned, first proposed and really pioneered the project. It was published to the general ASU by the School for the Future Innovation in Society, where SolarSPELL is currently partnered. One of the main goals was creating a team with lots of diversity, both in the backgrounds of where they're from, the majors that they had. We had students from computer science, public health, biological science, and even justice studies, as well as the levels of education, with students who are bachelor's, master's program, as well as the doctorate of nursing practitioning. Whenever SolarSPELL brings new students on, there's a period of onboarding that occurs. In these sessions, which are usually held in person, students have an introduction to content curation, what SolarSPELL is, and they typically have the opportunity to use and navigate a physical SolarSPELL unit and a published SolarSPELL library. However, due to changes from COVID-19 and the necessary social distancing rules, we did move onboarding sessions to a virtual platform, Zoom, So there is, instead of navigating the physical unit in person, students navigate an online version of the library to still gain understanding of how the SolarSPELL library works. Next step in our project was to continue cultivating our partnerships with South Sudan. The two schools that we're partnered with are the Juba School of Nursing and Midwifery. Students and faculty are pictured on the bottom right, and the Juba School of Medicine. Dr. Ross, Dr. Hosman, and Mr. Bakey all spoke with the heads of these schools to create a textbook wish list that identified the content gaps and needs of these schools from which the team could base future curation and content needs for our library's organization. This project in particular, at the direction of Dr. Ross, focused specifically on rural midwives. Rural midwives in this circumstance are midwifery students who train in the capital at the Juba School of Nursing and Midwifery and then return to their home communities that are very rural and lack resources even more than the capital necessarily does. In order to identify the appropriate resources for these students, I did additional research into what rural practitioners in the US and around the world did in areas such as the Appalachian Mountains, the Native American reserves, Africa, and India. Once we knew what resources we were looking for, we wanted to do some background research before we created the library. The first step was to do an analysis of existing online medical libraries. Each undergraduate student on the health team was tasked with finding at least one online medical library, documenting their organization, and discussing their strengths and limitations. A consistent limitation that we found amongst online medical libraries, besides the need for the internet, was that they often lacked open source resources, meaning that you had to pay in order to access this content or be a part of their organization. So then we decided that the next step was to determine some open source scientific collections where we could curate content from and guarantee we stuck with our open source mentality. The collections that I identified for women's health were the International Federation for Gynecology and Obstetrics, the Global Library of Women's Medicine, the National Institute of Health, the World Health Organization, Medical Aid Films, Omics Online, and the Public Library of Science. Dr. Ross and I have both been in contact with the founder of GLOAM, David Bloom, and through our partnership, we've been granted access to a memory stick that will deliver the entire content of GLOAM's website to SolarSPELL and our partners. Additionally, GLOAM has a small section of content that is not open source. These are surgical videos that require a credentialed physician sign-in in order to access to ensure the public doesn't have access to inappropriate resources. I've been able to gain access to these through our partnership with GLOAM, so that way we can provide these surgical videos to our partners in South Sudan, the medical students, and those who will be staying in the capital, so that way they can perform surgeries such as obstetric fistula repair and cesarean section deliveries. Once the needs were determined and our content sources had been identified, the following step was to create an outline document and organization for the library. We decided that in order to best balance clinical needs and classroom teachings, we needed 4 main doors or points of entry where the students could enter the library and access the resources most appropriate to their needs. These doors were determined to be procedures, disease population, disease diagnosis, population, and student reference. Student reference is specifically built for classroom use and not for clinical practice. There were 3 to 5 further subcategories that each main category had. This image is a breakdown of the higher level library organization. Shows that under surgical procedures, we have body systems, emergency medicine, anesthesia, diagnostic testing, and dentistry. For disease diagnosis, the subcategories are non-communicable diseases, communicable diseases, public health, pediatrics, and during COVID-19, we added a section for personal protective equipment. Under the population, there are 3 subcategories: midwifery and women's health, pediatrics, and adult. Under student reference, there's nursing student, medical student, midwifery students, dentistry, and a section for the instructors. For the actual curation of the content, we used a form in the format of a Google survey. This survey has guided curation based on the answers on the previous page. For women's health, it guides you through 4 pages. The first, collecting basic information about the curator and the resource itself. The second is where you sort the resource into one of the 4 main doors. All women's health resources in this step are sorted into population. On the following page, page 3, with tagging and metadata, where you can add additional subsections and keywords, it's possible to add a resource to an additional category. For example, if I was curating a resource for cervical cancer, the resource would begin under population and women's health, but then in page 3, I would additionally tag it for oncology, cancer, and non-communicable diseases, as well as any other appropriate tags. On page 4 is where we add a description, a short way to make sure that students know what they're looking at, usually 1 to 2 sentences. Resources themselves. For women's health, GLOM was our largest source of resources. Specifically, over 400 expert chapters on women's medicine are being uploaded onto the library. Safer Motherhood is an app that was put out by GLOM partially through the project that we're doing. This app is meant to provide practical clinical guidance and medical record keeping. However, not all of these resources are accessible in an offline environment, so in order to make sure that our partners on ground could still access these important resources, I reformatted them so that way they would fit into the PDF format that is accepted by the library and could be uploaded for use. GLOM also has open source textbooks and video tutorials that were uploaded as well. From the World Health Organization, health topic information pages were our main source of resources. However, similar to the Safer Motherhood app, many of the resources were not appropriately formatted for offline use, drop downs and other similar things that could not be translated. So I first reformatted them in Google Documents according to outlines that I created, and then converted them to PDFs for uploading to the library. World Health Organization also had regulations and guidelines that were uploaded to the library. Medical aid films was the main source of video content and tutorials that were located for women's health. They also had a plethora of regionally appropriate content and content for rural midwives, so that way they could perform procedures under resource-constrained conditions. FIGO and NIHS did not have as many resources as the others. However, they did have important guidelines for clinical practices, and FIGO is publishing further resources in the near future. Omics Online and PLOS are a good source of journal articles and case studies that can be used for evidence-based practice training in the classroom. Once all the resources had been collected, it was important that we did several reviews of the library. The first one that was done was for cultural and regional relevance. This was done by 2 students, Grace and Winnie, African exchange students who are studying in New York, partnered with SolarSPELL. They made sure that the resources were appropriate for the library and for East Africa, where South Sudan is located, that they didn't violate any legal rules or any other cultural standards that we wouldn't have been aware of here in the United States. If a resource didn't fit or they felt wouldn't be appropriate, they moved it and we saved it for future health collections in other locations, but simply made sure it wasn't included in this one. The following review was a metadata analysis done for consistency of curation, since there were many people curating different resources across different subjects. This was done by 3 graduate students, including myself. Once all of the data and the resources had been approved and made sure that they were appropriate, the next step was to upload the content onto the SolarSPELL itself. This was done by library information specialists and computer science students who we were able to partner with on a separate team. However, due to COVID-19 and the fact that we aren't able to review the library ourselves in person, there's also an online version of the library that was created for a review and to test search functions. I'd like to do a quick demonstration and visit the library now. I will paste the link listed here to the library in the chat at the end of the presentation, so that way we can explore the library freely and anyone can ask questions if they would like. But for now, I'm going to lead us through a guided tour. When you click on it, you can see that it leads you to the main page of the library, which has the 4 doors: surgical procedures, disease diagnosis, population, and student reference. For this example, I'm going to demonstrate as though we're in the classroom doing a project for evidence-based practice learning. As some of you may know, October is Breast Cancer Awareness Month, so we're going to do it as though our project is on breast cancer. Type into our basic search function, breast cancer, We'll return 6 pages of results, all of them either containing information about the breast or cancer or both. However, as I'm sure you may notice, not all of the resources contain them together, which is what we need for this project. This is where our advanced search function comes into play. We can go to the keywords and specifically search for breast cancer together to ensure that we get the best resources. This returns 2 pages of content that are only about breast cancer. Now, even if you don't see it in the title, it's been curated in the keywords, which means that it's a major topic. We scroll down, we say we like this mammography one. We'll say that we want to further our study. You can click on the resource, you can go in, read the actual article itself, you can download it from here, or you can view the other things, the creators, the keywords, and all the other metadata information that was tagged with the resource. So let's say for our project, we decided that we're narrowing our topic to mammography. We'll go back to the advanced search, keywords, we'll place mammography in there, and we'll search. Now we have 6 resources that are returned to us, and these are perfect for creating a presentation or writing a research article to make sure that we already have all the resources for evidence-based practice learning. And if you click on them, they all have the appropriate information for creating citations on the left, or some of them have the resource already cited in the top right, so that way they can appropriately cite it and make sure that it's properly. I'm going to go back to the presentation now. Onto the discussion section. Some challenges that we faced while creating the library. One challenge that we faced was determining relevance of resources. So first, making sure that they were regionally appropriate and followed the laws that may be different, but also making sure that there's resources for medical students who will stay in the capital and have access to machines that can perform mammographies, for example, but also for those rural midwives who won't have that resource physically available to them, and making sure that they have enough information for their knowledge to be relevant where they practice. There's another challenge that may not be immediately obvious, but if you go and search South Sudan life expectancy into Google, it'll return the answer of 57 years, which seems extremely young. However, when you take into account deaths 0 to 5, maternal mortality and pregnancy complications, and deaths from the war that's currently going on, you'll see that anyone who survives these traumatic events actually lives a long life, meaning that that's an underserved population that may not be considered in many intervention areas. So I felt it was very important to include healthcare for aging women in the women's health resources, so that community women would have access to health knowledge that may not be commonly available to them. Another challenge that we faced was being told no. When we go to curate content, that textbook wish list was really important to us to make sure that we fulfilled those needs. However, not all of the content was open access. In fact, most of it wasn't, meaning that we had to ask publishers for permission to use their resources. And even though we explained what SolarSPELL is and how we're using their content, the answer was most always no, or you have to pay, or you can have a small section. the other current member who's been with SolarSPELL from the beginning along with me, SolarSPELL Health, I should clarify, has done a wonderful job of continuing to reach out to these publishers. However, in the absence of a yes or a willingness to share, we've needed to curate substitute textbooks that cover the same topics but might not be the same title. Thankfully for women's health, GLOAM has a large amount of textbooks available open access that cover a large amount of topics, and there's not that many content gaps from publishers. Another challenge that was faced was COVID-19 delays. Our team faced challenges in delivering to South Sudan with the inability to travel, as well as the inability to meet in person. And our partners also faced trouble with their progress. For example, our partner GLOAM. GLOAM is currently in the process of a collection-wide update where they're adding additional expert chapters, they're updating old chapters, adding new textbooks, and new professional tools like the Safer Motherhood app. One of the textbooks that's coming is by FIGO, but housed through GLOAM open source, a continuous textbook of women's medicine where there's going to be 50 expert volumes, which will close a lot, if not all, of the content gaps that are currently missing through those textbooks that are gatekept. The original update was supposed to be delivered earlier this year. However, due to COVID-19, it's been postponed further until 2021. Due to this delay, I felt it was best for our partners on ground if I individually uploaded each resource that was relevant as opposed to waiting for the full library collection. So currently, as much of GLOM as I could get onto the library is there, but at future updates, when SolarSPELL goes into the field about every 6 to 12 months to update libraries, whenever the GLOM memory stick becomes available to us, we'll ensure to add those updates to our libraries. The next step is implementation. So one benefit of deploying to South Sudan is that SolarSPELL's already partnered there in the community, meaning that search skills and library literacy are skills that they already have where other communities might not have those skills. This really makes our implementation easier. So we really only have 3 steps. The first being to train the instructors at these health schools to make sure that they gain evidence-based practice skills, that they know how to navigate our library, but also to make sure that we do impact evaluation along the way and make sure our library is aiding them in the best way possible to update it as necessary. Then the next step is to evaluate the skills of the instructors and to make sure that they're using the library appropriately and that they're utilizing all aspects of the library that we've integrated. And the last step, along with the instructors, is to implement the new training with the students themselves of the health schools. We acknowledge at SolarSPELL that this is a long-term process. It's going to take a while before a new way of teaching and learning catches on. We understand that, integrating processes takes a long time, and the first and even second class of students might not have all the resources or all the understanding, but over time, it's going to improve health outcomes in South Sudan, especially women's health outcomes. To conclude, my goal was to improve women's health outcomes in developing and underprivileged countries by bringing evidence-based practice resources and education to these locations through SolarSPELL. COVID-19 may have affected our methods and timelines, however, it also showed the importance of digital health education. And it's really important to us at SolarSPELL that as the world moves to digital education, we continue to keep the world in resource-constrained locations with equitable access to education and make sure they don't get left behind. It's also extremely important to me that we provide additional resources and support to expand the care that can be provided, but not to discount or completely replace it. What South Sudan and the practitioners are currently doing is valuable and important, and we acknowledge that. We just want to help them do even better and meet the gaps that they're currently facing. Some future directions for SolarSPELL Health, as well as my master's project. As I mentioned, I'm doing the 4+1, so I will be expanding upon this current thesis in my master's. As far as general SolarSPELL Health goes, me, along with several DNP students and faculty from ASU, are looking to update the Train the Trainer model to be specifically tailored to applied life sciences. And then for women's health, I'm expanding from women's physical health into women's mental health and domestic violence, some serious issues in South Sudan. I recognize that these are sensitive and even taboo topics at times, which is why part of my project is reframing these issues as women's empowerment, making sure how nurses and midwives can provide the essential communication and mental health information to achieve safety and community health while also keeping those midwives safe. I'm now going to paste the link to the library in the chat so that way anyone can explore the library and ask questions if they have them. And I'm also going to open the floor to any further questions.
Great, Courtney, thank you so much. And yes, questions from the group. I see that Kurt has unmuted, so question?
Oh, I was already unmuted. I don't have a specific question at the moment.
Okay. Any other questions for Courtney from the group?
If you have further questions after viewing the library, which I just posted the link to, I'm welcome to those as well.
Okay, yes, go right ahead. And your screen also says Kurt. I don't know if that's your name as well. We have like a Kurt party happening here.
Yes.
an old family computer, I apologize.
It's like unmuting here. I might be able to unmute you. There you go. That's, whoops. There you go, you're unmuted now.
Okay, great, thank you. We were wondering for the best in the world, that were two mortalities out of every 100,000. You said that there were several countries that were tied for first with that statistic. Which countries were those? Do you know?
I do. Those were European countries. So Belarus, Poland, Italy, and Norway were the 4 countries that had only 2 maternal deaths per 100,000.
Oh.
Great, thank you.
Lindsay, do you have a question?
Okay.
What did you like most about this project?
I really enjoyed learning more about women's health in other countries. The resources that we have here and the kind of health education that's important to the United States is not necessarily the same that's important in other countries. So that it was interesting to learn what other women need and what their access is.
Courtney, I have a question.
Okay.
What would you say was the single biggest challenge of this project?
Uploading GLOAM content individually. We had originally planned on receiving that memory stick. GLOAM, the expert chapters alone, has over 400 resources, and altogether there's over 1,000 resources on the GLOAM library. So balancing uploading other content that was important with ensuring that the GLOAM resources that I felt were very relevant got uploaded onto the library was a time-consuming process, and just making sure that as many as possible got onto the library.
Wow, thanks.
I have
Yes.
a question related to that. How much of it did you do versus the group? Because you said it was a group project.
So SolarSPELL Health serves all the areas that were listed on the main categories and subcategories page. So it's not just women's health by any means. However, I would say the large majority, probably 80 to 90% of women's health content, if not all of it, was I did personally.
A lot of work.
Yeah, definitely. It's been a long project. Because I'm on an off semester, I've had actually almost 2 years as opposed to the typical time frame.
Yeah. Very cool.
And it's an ongoing project. You know, a library is never finished, and SolarSPELL is no exception. So despite the GLOAM update, I'm sure there'll be future updates, and I'm continuing content curation even after this presentation. The project's never done.
Oh, I have another question. Once
Go ahead.
COVID is really, like, we can go back out, I'm sure you're planning on going to South Sudan.
You know, as much as I would love to go to South Sudan, there is a concern because South Sudan is rated, I believe, level 4, Dr. Ross? Level 4, which means that only a couple of professors with a security detail are allowed to go to South Sudan for implementation, and unfortunately no students are directly allowed. However, for future SolarSPELL Health projects, we intend to expand to other areas such as the Pacific Islands, and I would love to travel to those locations to help implement our program.
Yeah, I'm guessing you would want to see where your stuff is going and meet the people.
Definitely. When I joined this project, travel abroad was definitely something I wanted to do. I just understand that safety has to come first for us as well, so we're not a liability, and for the people we serve.
Makes sense.
Courtney, you may want to also mention the South Sudanese community in Gambela.
Yes. Right. There are refugee communities, Gambela, Ethiopia, where it's possible to visit the South Sudanese population that we are serving without actually going to South Sudan in a safer location, where we might be able to deploy the library to those locations without having to create an entirely new collection. And it would be possible for students to travel to there.
Excuse me, I have a question.
Yes, Lindsay?
How many people are on your team?
Ooh, that varies. I'm a part of a couple of teams. The graduate student team as well as the SolarSPELL Health. And we're constantly having students graduate and new students join. So on average, we have anywhere from 6 to 12 students on the team, I would say.
Thank you.
Thank you, Lindsay.
Very good. Any additional questions from the group for Courtney? All right, well, hearing none, I want to thank everybody for coming. I especially would like to thank Lindsay for not only asking excellent questions, but also having the very best kitty ear crown that I have seen certainly all day, if not all year.
Thank you.
So with that, thank you so much to everybody for coming. I will gently dismiss you from this presentation now, and Dr. Hosman and I will have some additional questions for Courtney. So thank you very much.
Thank you, everyone, for coming.
Thank you.
And I'll go ahead and just,
Thanks, Dad.
okay. Great. And yes, you saw he got in his chat just as I was removing him. So he snuck it in. Perfect. Good. Good. All right. Courtney, wonderful, wonderful presentation. Without giving anything away, I will share with you that this is one of the best culminating project presentations I've seen from any student at any time,
Thank you.
undergraduate through doctoral level. So thank you for that.
I would second that. This really kudos and bravo on an amazingly professional and thorough and entertaining isn't there, help me out.
Yeah, I mean, engaging, yes, yes.
Consistently
Thank you.
engaging presentation
I'm glad.
throughout. So great job.
So I saw, Dr. Hosman, that you sent over your some notes in the previous hour. So I don't know, Courtney, if you had a chance to go through those. And as I'm paging through, and I apologize, I was giving a presentation just right up until this, so I didn't have a chance to look at it either until just now, but some very nice, substantive notes. And I have just a few also from a writing perspective.
Okay.
But Dr. Hosman, did you have any other questions for Courtney?
Not really questions. So I'm also very happy to go through the actual thesis with you. As you will see when you do open it and page through it, my there were substantial revisions, but they were superficial revisions. So
Okay.
they're not of substance. They're not anything that you're going to need to rethink any sections, etc. But a good number of detail-oriented.
Okay, of course.
If you would like to talk through them, I'm happy to, but I also think that they're so sort of superficial, if you will. You'll see what I mean when you look at them. So either way, happy to meet again, or
Yeah, I guess I'll take a look at them after the meeting and then we can go over it at that point, possibly.
Yeah, as I just looked through them, it looks like they're very clear cut. Like,
Okay.
I'm not sure what this acronym is. Make sure you define it first, that sort of thing. Along similar lines, there were a couple of things I picked out. Oh, one thing about, and it's so gracious of you to mention Grace and Winnie. And their contributions, which I think are incredibly special for and necessary for this project. They're not exchange students, just so
I'm so sorry.
Not at all, no, and there's no reason that you would know that. They are full-time U.S. college students.
Okay.
And Grace is a student at University of Rochester in New York, and Winnie is a student at, I want to say either like, not Southern Methodist, it's somewhere in Georgia.
No,
That
she's
should
in
be-
Abilene, Texas.
Oh yes, Abilene, that's right,
Okay,
Abilene, Texas. So
good to know.
just,
I'll
yeah,
make sure to update that.
yes, that was one of the things that I pulled out, like, oh, we just need to make sure that we
Yeah,
are correct about that. Yes.
they are both from Africa originally, though,
They are.
correct?
They're both
Okay,
South
I just want to
Sudan.
make sure that that's accurate information.
Yes, yes. Not just Africa, but specifically South Sudan. They are both South Sudanese.
Didn't know that. That's great. I'll make sure to include that for sure.
You may, along that line, want to mention Mpa as well, who is a full-time ASU student from Botswana. Her home is in Botswana, but she's not an exchange student. She's a full-time ASU student. Yes. And now Botswana obviously is in southern
Sure,
Africa,
but still the continent and all of that.
but has some extremely relevant.
Definitely. I can make sure to add her as well.
And like I said, so gracious for you to mention them. And then, as I mentioned to you in whatever it was, 12 seconds yesterday on a Zoom call, one of the things that I would love to see in your written presentation is I want to see more of you. In the presentation, and to the point that you had fielded a question from one of the audience members, so what part, you talk about the team, which is a really important way to talk about the project, but for your thesis, what did you do? And that's not to say like, are you hiding behind this team and really claiming their work? Quite to the contrary, you did a huge amount of work. And so I want to make sure that your thesis reflects your contributions as well.
Okay. Do you have any suggestions for how to keep the more third person writing while also mentioning myself? I did struggle with that a bit.
Yeah, so this is something that a lot of students struggle with. The dogma for so many years in scholarly writing has been that one only writes in the third person, and that's changing. So when you're talking about either we as a team, we did this work, that's first person plural, right? You also, when you talk about I, like work that you specifically did, and the reason that you're talking about it is because you did it, it is appropriate to use the first person in that case. Now, Dr. Hosman, are you also in that school of thought?
I actually appreciated the tone of the paper up till now. So Dr. Ross, are you recommending that there be a separate section with Courtney's individual contributions, and maybe that has an I tone that makes it clearer?
Yeah, I think so.
Okay.
I think that would be appropriate, because there is absolutely that scholarly third person, here's what it is. Yes, there's a reason that that's the accepted form. Where we've run into, where there's been some movement in recent years, I should say, is a lot of students were coached over the years to, well, because we're we want to stay in third person, and it's bad to use I in scholarly writing. I've seen students say, this author undertook, and things like that, which gets really pedantic and awful.
A little bit. Yeah.
Yeah. So there is this modern movement to, when it's appropriate, when you are talking about yourself, right? Mm-hmm. To claim it, own it, and use I. I think that the suggestion to put it in a section mm-hmm. and say, like, this was my individual contribution is a perfect solution.
Yeah, I think I can, since we don't have a results section necessarily, I think I'll put it in between methods and discussion, as long as that works. Just kind of a personal contributions. I can update the table of contents and such.
Yes, I think that's outstanding. And I think that then accommodates what we always want you to be able to represent, particularly for very much a group effort like this, and an ongoing group effort. because this is your honors thesis, what was your work? I want to make sure that you get credit for your work. Okay,
I'll make sure to add the section in.
very good. Because this does get archived in the Barrett Honors College, and it'll be important for, you know, all of eternity, you know, to be able to look back on this document and see all of the incredible work that you did.
Yeah, thank you.
Okay.
Right.
Anything else, Dr. Hosman, that you can think of?
No, I really appreciate your idea, Dr. Ross, of having this extra section with Courtney featuring your work. So that sounds great.
Good. Very good. Courtney, any questions for us?
Not on the subject, I guess, just on where we proceed. For as far as accepting and passing and all of that, do you guys have a discussion between the two of you? Will I need to leave in a meeting room?
Yep.
A waiting room, I mean?
We're going to discuss now, and I am going to remember how this works, where I'm going to move you to a waiting room for a few moments. So just hang out, and then we'll bring you back in a few moments.
Okay, thank you so much.
Super, thank you.